have an appointment today?
Yes, I do. My name is Brandon. I think I have an appointment for a 60-minute massage with, I think it was with Emma in 15 minutes.
Okay, just give me a moment. Just gonna check here. Okay, Emma. Okay, yes. Brandon. Okay, well, thank you for coming. So I just checked you in. So we did email you some forms for you to fill out. I think it was
Okay.
an intake form and a consent form.
Yes.
Did you fill them out yet?
Yes, I have done those, yeah.
Great. Just let me just double check here. Yes, you did complete them. I see that this is your first appointment. We do have a few questions before we get started here.
Okay. Yeah, for sure.
Okay, so we have your name here. May I ask, what pronouns do you prefer?
I could use either he, him, or they, them. Really, I'd say either of those is fine.
Okay, well, thank you. So, also, do you use any medications that may affect your massage, such as blood thinners, heart medications, or painkillers?
I am on painkillers, as well as a few other medications, but my doctor did say that my other medications will not have any impact on massage. But I am curious here, how do painkillers affect my massage?
Oh yeah, for sure. So for painkillers, they can affect the way you feel pressure and pain. So when taken in a certain time frame before your massage, so it is important to know that if you have taken any before the treatment, we just want to make sure that it doesn't cause any harm. Does that make sense?
Yeah, I think so.
Okay, no problem. Okay, so just one last question. How did you hear about our clinic?
I got my mom actually sent me a Facebook message about you guys,
Okay.
and so I've just been following her up from that.
Okay,
Yeah.
it's good to hear. Okay, so just wait a moment here, and I'll just go notify your therapist, and she'll be out here shortly. And if you like, we do have gender-neutral washrooms just around the corner here. If you need to use them before
Okay,
the massage. Okay?
I'll be fine, but thank you.
Okay, just give me one moment here.
Hi, Brandon.
Hi.
I'm Emma. It's nice to meet you. You can just follow me and we'll go into the treatment room.
Sounds good.
In the room, you can just have a seat wherever you're comfortable. And like I said, I'm Emma. I'll be your therapist today.
Hi, Emma.
How are you doing?
I'm doing all right. How about yourself?
Good, thank you. So what brings you in for a massage today?
So I have a bunch of tightness and some pain in my chest from a surgery that I actually had a few weeks ago.
Okay.
So I've tried a few things at home to try and lessen the pain and make myself feel better, but nothing's quite done the trick. So I'm also feeling pretty anxious about all of this. This is my first. It's my first time coming in for a massage, so it's a very new experience.
Okay, well, thank you for sharing that, and I'm really glad you're here. One thing that we can do, just to make you feel a little bit less anxious, we do have a student massage therapist that can join us for this session, just to kind of ensure a safe and secure environment for you. Is that something you're interested in?
Sure, yeah, we can do that.
Okay, I'm just gonna go grab him and just let him know what's
For
going
sure.
on, and then I'll be right back, okay?
Sounds great.
Okay, so Brandon, this is Chuong. This is our student massage therapist, and he'll be joining us if that's okay with you still?
Yeah. that's
Okay,
good.
so you can just have a seat, Chuong, wherever you're comfortable too. So just continuing with the interview. Are you comfortable telling me with what kind of surgery you had done?
It was a double mastectomy.
Okay. And what areas specifically are you feeling the pain and discomfort in?
Obviously, here, but also the sides are quite bad on both.
Okay.
Yeah.
Is there one side that you think is worse?
No,
than the other?
I'd say that they're both about equal.
Okay. So just so you're aware, we do use gender-neutral draping. So
Okay.
your chest and breast tissue will be covered at all times.
Okay.
Just to kind of let you know there.
Okay.
And it says here that you mentioned you're on painkillers. What kind would that be?
Oh, it's just some over-the-counter Advil.
Okay, and have you taken any today?
Yes, I took 2 this morning.
2 this morning. Okay. So just to let you know, we will be using a little bit of a lighter pressure just
Okay.
to compensate for those painkillers that you took this morning.
Okay.
Another thing that we can do for you to create a safe environment is create a safe word or a safe gesture. And if you do use it during the massage, I will immediately take my hands off of you, and then I won't put them back on until you say it's okay and give me your consent again.
Okay.
Is that something you would like to do?
Yeah, let's go with the safe word.
Okay. Is there a word that you have in mind?
Maybe we could use something just like space.
Okay. I will keep that in mind, and if I hear anything that is that word or something similar, I will stop the massage immediately and not go ahead until you say.
Okay.
So speaking now about your pain, is it constant for you, or does it kind of come and go?
It's fairly constant. It eases when I'm sleeping or laying down for a short period, but it doesn't ever fully go away.
Okay. And does it radiate anywhere other than the areas you showed me earlier?
I don't think so.
Okay.
No.
On a scale of 1 to 10, 1 being minimal, barely feel the pain, 10 being extreme, kind of call an ambulance, how would you rate your pain right now?
I'd say right now it's probably like a 5.
Okay. And when it's at its worst?
At its worst, it probably gets up to 6 or 7.
Okay. How would you describe the pain? Is it anything like achy, dull, pinching?
Achy is probably a good word for it, but it can also be at times like sharp or stabby.
Okay. Have you found anything that makes the pain worse for you?
Worse, I've found that laying on my stomach is painful.
Mm-hmm.
And then when I go for my jogs or when I'm jogging, like the bouncing motion, it hurts.
Okay. Is there anything that you find relieves the pain?
The Advil I take and maybe an occasional ice pack.
Okay. Does this pain affect you in any other ways? You mentioned earlier on that you do have anxiety. Have you found that's increased since the surgery and the pain?
No, I don't think that's increased because of the pain. If anything, I think my anxiety has actually gone down since the surgery, just because I feel a lot more comfortable with who I am.
Good.
Yeah.
Okay. Yeah, thank you for sharing that. So for the massage, I'm thinking that we will focus on kind of the upper chest, so your pecs, as well as the sides that you're saying is feeling a little bit sore and painful. And as well an abdominal massage, just to kind of help maybe with some pain or
Okay.
swelling. Are you comfortable with those areas?
I think I'm good with the face up and the side, but I don't think I want to do the abdominal.
Okay, totally fine. Thanks for letting me know. And of course, everything we do here is totally up to you and what you're comfortable with. So thank you for letting me know that. We won't do the abdominal massage, but we'll stick with the other ones. Through this massage, we're hoping to decrease the pain and tightness you're feeling, as well as just help you relax, as that can help with lots of things. There may be some sensitivity with like tenderness, sore muscles throughout the massage, but if you're uncomfortable with anything, or if you want more or less pressure, just please let me know and we will adjust accordingly. And of course, if you use that safe word, that's an immediate stop.
Okay.
Do you have any questions about this?
So am I going to be like facing up the whole time, or are you going to have me flipping over?
So my thoughts on that is that you'll be face up for a good portion of the massage, and then we'll have you flip just onto your side, so your side lying, just to access kind of those side muscles that we were
Okay.
talking about.
Okay.
Is that okay with you?
Yeah, that should be good. I just don't want to lie completely flat,
Okay.
because I find that if I'm lying flat for more than just a few minutes, it can start to hurt. So is there any way that we could maybe like prop me up or anything like that?
Yeah, absolutely. We have lots of pillows here at the clinic, and
Okay.
so what we can do when you're laying on your back, we can kind of put them underneath your shoulders and like your torso, so you're not laying completely flat, you're propped up a little bit. And then same with side lying, you can just have a pillow there. We can kind of figure that out as we go, what's comfortable for you. And yeah, does that sound okay to you?
Yeah, that sounds great.
Yeah,
thanks.
awesome. So if you don't have any other questions, do I have your consent for the massage today? as well as the special consent just for the PECS area?
Yes, you do.
Okay. So, Chuong and I will just leave the room to let you get on the table. Undress to your comfort level. It is completely up to you what level that is, and if you'd like to stay fully clothed, that is an option as well. We can still get an effective massage that way.
Okay.
And once you've done that, you can get underneath the top sheet on the table, laying face up, and then we'll come in with the pillows to adjust after that. And we will be sure to knock on the door before you come back in.
Awesome.
Sound good to you?
Yeah, that's great.
Awesome.
Thank you.
Okay. Thank you.
See you soon.